Headache and dizziness of a 54-year-old man is the case study I'm going to be talking about today. The patient has a history of migraines where he uses sumatriptan as an abortive medication to treat the migraines. He's been complaining of dizziness, imbalance, and right-sided ear ringing for the past 3 weeks. A mild low-intensity headache around the whole head, not localized to any specific spot. This is not consistent with prior migraines, suggesting that there is an underlying disease occurring. Some key exam findings with this 50-year-old man included moderate right-sided hearing loss, which was shown through his audiology. He had an absent response to caloric test in the right ear, and he has an unsteady balance. The MRI he received also showed a 2-centimeter mass in the internal auditory meatus. Why demographics matter? Depending on the disease you're speaking of, it can be more common at different ages or on a certain gender or even certain races. So it's important to know how likely you are to have this disease based on your demographics. Some medical terminology that was used throughout this case, and then I'm going to explain 3 of them. Migraine, tinnitus, vertigo, concussion, labyrinthitis, Meniere's disease, glioblastoma, audiologic, tympanic membrane, sensorineural, vestibular schwannoma, nystagmus, caloric stimuli, neurologic, acoustic neuroma, and there are many more, but I'm just listing 3 more where I'm going to explain what they mean. Labyrinthitis, so labyrinth is meaning the inner ear structure. Itis means inflammation. So combining these 2, you would get inflammation of the inner ear structure. Glio refers to your neuroglia, which is a type of cell. Blast is immature cells, and oma means tumor. So it's an aggressive neural brain tumor from glial cells. Audiologic. Audi means hearing. The O is a combining vowel for audi and logic, which is the study of. So it's a thin membrane separating the outer and middle ear. Some abbreviations found in this case, so BP is your blood pressure, which refers to the force of blood against the walls of arteries as the heart pumps. It's a critical vital sign to monitor, and in this case, the patient's blood pressure was 120/70. This suggests no immediate cardiovascular issues. 120/80 is the baseline, so 120/70 is a healthy blood pressure. Pulse is your heart rate. S1 and S2 are noted during auscultation of your heart sounds. It's your first and second heart sound. Cranial nerve 8. MRI, which is your magnetic resonance imaging. This is a diagnostic imaging that creates detailed images of your organs and tissues. In this case, he had a 2-centimeter mass on his MRI. COVID-19, which stands for Coronavirus Disease 2019. HEENT, which is your head, eyes, ears, nose, and throat. This abbreviation is a very common use with physical assessments of the upper area of the body. In this case, the patient had issues related to his right ear, which is involved in the HEENT assessment. So there's a few possibilities within this patient. An acoustic neuroma is the most likely for this patient because of the right side, because he presents with one-sided hearing loss, persistent ringing in his ear, and vestibular symptoms like dizziness and imbalance, which are classic signs of a tumor affecting cranial nerve 8, which is spoken to in this case. Meniere's disease would not show a tumor, which in the MRI we did see a 2-centimeter mass. Metastatic tumor usually presents with multiple lesions or a known primary cancer, not just that mass we saw. Benign glioma normally arises within the brain parenchyma and not within the internal auditory canal. Acoustic neuroma of the right side is most likely with this patient. Significance of medical terminology. It can ensure clear and concise communication among healthcare professionals, reduce risk of errors that could harm patients, promote standardized documentation in patient care, help maintain patient dignity and confidentiality, facilitate efficient collaboration between healthcare teams, and improve overall patient safety and quality of care. This is done through proper protocol and documentation so that everyone within the healthcare team and professionals of the patient know exactly what is going on, and there's always a lot of overlap among the different professionals taking care of a case, so it's important to document correctly so that everyone really does know what is going on. This will reduce any sort of harm that could occur with these patients and improve the overall safety and quality of care.